Hello, everyone. My name is Wendy Myers. Thank you so much for listening to the Live to 110 podcast and tuning in today. Today, we're going to be talking about a very important subject, which is how to properly remove mercury fillings. And a lot of clients ask me, should I remove my fillings? Yes. Mercury is the most toxic metal known to man that's naturally occurring, causes a lot of different health symptoms, over 100 different symptoms, health conditions, headaches, migraines, chronic fatigue, and it's the most common toxicity. Among my clients, among many other detox practitioners' clients, mercury is the most common metal found, and everyone has some amount of this in their body. Really hard to avoid. It's in most fish, except the little fish like sardines and herring and anchovies. They don't live long enough to accumulate much mercury. But it's also in mercury fillings. It's in still in many vaccines today, and we breathe it in the air through cold burning, and frighteningly enough, from crematoriums in the cities. They're peppered with crematoriums that are burning bodies, and the mercury in those bodies and the mercury fillings in those bodies are burnt and then released into the air, and we breathe it in. That is why it's the most common toxicity today. So listen up, you do need to detox mercury from your body. So let's talk a little bit about our guest today. Dr. Bill Glaros is coming on the podcast, and he is a biological dentist in Houston, Texas. And he's going to be talking about why mercury is so dangerous, why the ADA and the American Dental Association and the FDA and don't protect us from mercury. The FDA is the Food and Drug Administration. I'm having some brain fog right now. And how you can find a mercury-safe dentist, a biological dentist, to get your mercury fillings properly removed so they don't poison you. But before we get into all that, just want to let you know that this program is not intended to diagnose or treat any disease or health condition and is not a substitute for professional medical advice. The Live to 110 podcast is solely informational in nature, so please consult your healthcare practitioner before engaging in any treatment that we suggest today on the show. So our guest, Dr. Bill Glaros, has been practicing dentistry in Houston since receiving his degree as a doctor of dental surgery in 1974 at the Baylor College of Dentistry. He also holds a bachelor's in psychology from Southern Methodist University. Over the past 13 years, Dr. Glaros has made 10 week-long medical dental mission trips to Guatemala, sponsored by Faith and Practice, and serving with a core of friends and colleagues. And it's always the highlight of his year. And his leadership has made Dr. Glaros a highly respected figure in the field of biological dentistry. In 2013, he was honored to accept an invitation to be interviewed by leading natural health expert and integrative physician, Dr. Joseph Mercola. Every year, he has a week of safe dentistry, biological dentistry, to inform consumers about the dangers of mercury and mercury amalgam fillings. Dr. Glaros was born in West Laco and raised in Houston, Texas. Dr. Glaros has been married to Joanne, his wife, the one who has worked in his office for 30 years, or actually longer. She's worked there since 1970. And they're the very proud parents of 3 adult children and 4 grandchildren. Dr. Glaros, thank you so much for coming on the show.
Thank you very much for having me. It's a pleasure to be here.
Why don't you tell the listeners a little bit about yourself and your background?
I'm from Houston, Texas. I went to Southern Methodist University and got a degree in psychology. I was trying to figure out a career path, and I looked at my dad, who was a dentist. He loved his work. He did great work. He provided for us well. I thought, that's for me. So I went to Baylor Dental College and graduated from there.
Okay, great. Yeah, and so we're going to talk about mercury fillings. So why don't we just start with the basics? What exactly is in a mercury filling?
A mercury filling is an amalgamation, a mixture of silver, copper, tin, and zinc, and mercury. 50% mercury, 50% the other the 4 elements, pardon me. It's been used in this country for 150 years as a filling material because compared to what they had back then, it worked great. It lasted a long time, relatively easy to put in place, and it was affordable. Those features are still the features today that people use mercury fillings, but a difference now is that we have a lot of choices of different types of restorations, short of crowns, filling materials that actually work very, very well. So it's been used for a long time in this country, and the users of it have a lot of support, and we'll be talking about that as we go through the interview.
Yeah, and so what is the difference between a mercury filling and a silver filling?
Nothing. It's just a name, and it's a name that the American Dental Association has said, "Gosh, let's don't call it a mercury filling. That would unnecessarily scare people or make them uncomfortable." And I'm going, yeah, because they're smart. I think there was a Zagat poll or somebody that figured out that 90% of Americans do not know about mercury and mercury fillings from their dentist. It's from other sources if they know at all. So most people don't know. And a mercury filling, a metal filling, an amalgam filling, it's all the same. It's a mercury filling. Our patients will tell us, my dentist told me he doesn't place mercury fillings. He places silver fillings. It's deceptive. It's misrepresentation.
Yeah, and most dentists today will put a mercury filling in you if you allow them, especially if you're looking to have, cheaper dental work done, which a lot of people are. So, what are dental students being taught about mercury fillings in dental school?
Well, one thing that is my understanding that half the dentists in the country, in the United States, no longer place mercury fillings. So we call those people mercury free. When in October of 1984, our receptionist came to me and said, "You didn't place a mercury filling this month." And I said, "Great, I quit." That day I became mercury free. I didn't have the term then, but I just knew I was never going to place another one. Beyond mercury free is a statement of mercury safe. And when we get down to some other details, we can talk about that. But please, in dental schools, because I think that was your question, yeah?
Yes, yeah. So, what are dental students being taught about mercury in the dental schools?
The same thing they were taught 100 years ago. It's okay. They said for 100 years, the mercury is solid. The mercury is held in that filling material. You combine it with those other elements, and the vapors no longer released. It wasn't true ever, and it's been 40 years. excuse me, 40 years that there's been an instrument that can measure that. It's used by OSHA and anybody, all federal agencies, and any personal agency that wants to keep track of mercury vapor levels. It's called a Jerome Mercury Vapor Analyzer. I looked it up today. It's been around for 35 years in its current form. It's a great instrument. I bought one, a used one from a dental supplier or a dental meeting that I was attending. Not an ADA dental meeting, but one of our group. And we used it over and over. People would, with mercury fillings, we would check the mercury vapor level in their mouth, and it would be low, maybe 25, 30 micrograms per meter, cubic meter. We'd give them gum to chew, and after 2 minutes of chewing gum, we would take the gum out and put the meter in, and it would peg the meter. I mean, it would close the factory if that was on the floor of the factory.
Wow.
So it's not a secret anymore. It hasn't been for 40 years. However, the American Dental Association has still supported the concept that they're safe for people.
Yeah, and why is that? How can all the dental schools in this country and the American Dental Association teach the techniques and support the use of mercury fillings? I don't understand.
And I'm with you. They I tried to give them some slack here, and I thought, well, and they were founded in 1859 under the principle that mercury fillings were okay. So I could think, well, they're being true to their founding principles. But there's abundant evidence that this most toxic metal is coming out of them, and that's not a defensible position anymore. Sometimes people say, follow the cash. Where's the money? I'm not a real student of this, but I can't find I can't find a path. The American Dental Association did have a patent on the high copper mercury filling, which was more expensive than the others. I used that for the first 10 years because it was the best. And I could polish it, which makes the mercury come out faster than ever. It was a horrible plan, but I used it. They had the patent on that, and maybe that's how they fund the lobby fund that they have, which is very rich. I used to think maybe they're just protecting dentists. As long as they keep that position, the dentists who are using this material would not be exposed the same. So in California, in the 80s, a man was suing his dentist, the dental supply company that provided the materials, and the American Dental Association. I thought, okay, here's a chance. The ADA is gonna back up this dentist. The first thing the ADA did was go to the judge and say, hey, we're just a they call themselves. We have nothing to do. We're just a trade organization. We don't have anything to do with what the dentist buys or places in his patient's mouth. And so they got out of the suit. So I have no understanding why that's the case. Even crazier is, what's the FDA doing? And that, I had a chance in 2011 to speak to the FDA Commissioner of Materials, and that was a guy named Jeffrey Shuren. And I got to present my case, and I'd like to read some of that if I may.
Yes, yeah. Yeah, because I definitely want to know what's their stated responsibility to protect the American public. What are they doing?
Well, first of all, you got to send a knife. I'm honored and excited to be before you to speak to people in a position to alter the health of our nation. There's a war going on in this country. It could not be considered a civil war. Civil, yes, because it's social, national, and public. Not civil, because it's not polite, not civilized, not courteous, not gracious. Its obvious victims are unborn children and their pregnant moms, school-aged children, and women of all childbearing age. Its victims include people of any age with a compromised immune system, people with environmental sensitivities, and most economically disadvantaged people who get mercury fillings or nothing. So I was charged up. The FDA in 2006 gathered a panel of experts. I called this to their attention in case they forgot. At that meeting of experts, 13 of the 20 recommended restricting the use of mercury fillings for pregnant women and children. We know that the warning was even put on their FDA consumer website. We don't know why the warning was removed. Within a year, and how we concluded that mercury fillings were safe again, but they just did it. In 2010, they did it again. So we had our people there taking notes about the same discussions. The conclusions they came to after that meeting were preposterous. But that was what they did. Now, I'm not going to get into this total political event here, but the head of the FDA, the whole FDA, was employed by a dental company, a dental supply company, and medical supplies who sold more mercury filling materials to the United States and European dentists than any company in the world. She was the president of this company. Her job after this, head of the FDA. She said, I will recuse myself from this. She sold her stock. She didn't sell her stock options. So it's just, if that doesn't stink the worst, there's lots of things I can go into here, but why don't I say that I've chosen the high ground here. The FDA is not going to save us right now. There's some work that's being done by a friend of ours, Charlie Brown, who if I have a chance, I'll talk to about later. But the FDA is not going to protect us.
Yeah,
we have to educate people. We have to educate our patients. We have to tell the truth. And there was a time when there was a bigger risk at that in Texas because the state boards were all over you. All of us who've been doing this a long time have been subject to that. They are not so actively trying to stop it anymore. I wonder how many of them still place them. I don't know.
Yeah.
But this is my naivety again. At this meeting, I said with the FDA, let's start with honest labeling, follow that with standard, truthful, informed consent, and third, we need to protect the most vulnerable. Nothing. I sent him a letter 2 months later. Hey, remember me? I'm the guy that... Nothing. He's still in charge, so...
Yeah, it's a sad state of affairs. It's a very common story, a very common scenario that money talks with the FDA, and they're supposed to protect the public, but they protect the interests of the companies who pay them. So it's a sad state of affairs. So let's talk about mercury toxicity. This is the number one metal toxicity. And what are some of the symptoms and dangers of mercury toxicity?
First, I want to commend you. I read you had some 9-page article about mercury toxicity, sources, and detox. And I loved it. In there you said, I counted, you had a page and a half of the symptoms that people had. And I counted them. There was like 104.
Yeah.
And then I was reading a book, getting ready for this presentation. This guy, McGuire, The Poison in Your Teeth. He's talking about, he said, there's over 100 symptoms.
Yeah.
That's what Wendy said.
Yeah, well, I think I was only able to, I didn't list all of them. I mean, there's certainly many, many, many more, but, you know.
So what we see is people will talk about a brain fog. So, well, we know that mercury crosses the blood-brain barrier. We know it crosses the placental barrier. We know that we already know how toxic it is, the most toxic material naturally occurring on the whole planet. There's no level. Oh, well, that'll be okay. It's not safe. And so, once again, we have to get off of why aren't they telling us that? And the symptoms can be, very often, the neurological symptoms. Often people get their mercury fillings removed, get detoxed, and they go, my brain fog went away. It's a common term. They didn't know that it's used often. With chronic exposure to mercury fillings, it can affect the oxygen carrying capacity of the blood. A red blood cell has 4 binding sites on it, sulfur binding sites, and it holds oxygen and carries oxygen through the body. And mercury loves sulfur binding sites too, so often it appears that the mercury filling jumps on the red blood cell, kicks off 2 oxygens. You've got 2 oxygens and 2 mercury molecules going around the body. If you look at the blood chemistries of some people that are totally without energy, like they used to be, and full of energy, and their red blood counts are like double what we would expect for them. Well, if there's 2 mercuries on there and not 4, that would explain why the body's always trying to do the right thing, I believe, and we get in the way of that. So a lot of these people will get the mercury fillings out of their mouth, and will get a good detox program, get out of their body, and their red blood count goes back to normal, but their energy level is good.
Yeah.
So that's one of the factors that it does. There's a chemist, Boyd Haley, who was the head of the chemistry department for 10 years at the University of Kentucky. And he has so much evidence showing that mercury fillings or mercury vapors from whatever source can cause the symptom of Alzheimer's disease. But he's been shut down on being able to get funding for anything. Isn't that interesting?
Mm.
Sad. I mean, he's genius. It's interesting. Mercury can make intestinal bacteria resistant or immune to mercury, and therefore it makes them resistant to antibiotic and antifungal treatments. So often people will have a candida problem, and they'll be going to their physician trying to get rid of it, no success. What do we know about candida? We know that in the body, the bacteria in the gut methylates mercury, which is more toxic. Candida demethylates mercury. It's a friend. Once again, the body is doing exactly what it needs to do in our highest interest. So we have often found that patients can get the mercury out of their mouth, out of their teeth, detox, get out of their bodies, and then the candida, the same protocol that never worked before, works with ease because the candida is finished with their good work.
Mm-hmm.
It's just sad that we can't do anything better than we're doing right now.
Yeah, and I know you could go on and on and on about the symptoms that mercury toxicity causes. I mean, headaches, pain syndromes. I mean, just
yeah. And so, as a dentist, I have to be very careful. We have patients call every week and talk to Joanne, who's my wife, who excuse me, who has worked in our office we've worked together for 30 years, doing this stuff together. And people will call her and say, call the office and get Joanne. Well, I want him to tell me if this is causing my health problems. And she'll say, gosh, I wish he could tell you that. I wish he was licensed to. But he can't. He's not licensed to. And if somebody gets an understanding that he's diagnosing medical symptoms and treating them, he'll lose his ability to practice dentistry.
mm-hmm.
So I'm very, very careful. Appropriately, because people come in and they're often working with somebody like you, working with a physician, a naturopathic doctor, a acupuncturist, nutritionist. They have a trust in you, and they're going to follow your protocols. There's so many ways to do it, and it doesn't seem critical exactly which way. Some people say, oh, don't start any detox until all the mercury's out. Other people say, oh my gosh, you got to start the detox and get it ready to get out. It works on both sides. It works both ways. So people would like to know, and understandably, but we just, for medical legal reasons, which is very critical, unfortunately, these days, we tell them that we will help. We know the protocols, and that's what we do. We follow those protocols.
Yeah, I mean, the research is well established. I mean, you don't even have to diagnose someone. Reader or listeners can go on PubMed and go on other places. There's hundreds, if not thousands, of research studies on the toxicity of mercury, proven beyond a shadow of a doubt. So, Dr. Glaros, can someone call your office and get information or an appointment to find out if they have problems with mercury toxicity?
Not if they have problems with mercury toxicity.
Mm-hmm.
They can call if they're ready to get their mercury fillings out. They will call us often, and they might not be anywhere near us in the country, but they know from some other things they've seen that we're a source to contact. And that's where it gets critical for the patient. You have to get educated. It's not so easy a thing that you have that you can just call a hotline, because there's two organizations, the International Academy of Oral Medicine and Toxicology and the International Academy of Biological Dentistry and Medicine. Big names.
Mm-hmm.
But those two groups, and I'm a member of both because I want to support any group that doesn't like mercury fillings. So there might not be anybody that's all you have to do is be a member to do that. To join, you're a member of those organizations. People have to get educated, so when they call the office, they're interviewing the office. They have to look at the website. They don't have to. It's a good idea to look at the website. If you want to go to a mercury-safe dentist, then there ought to be something on his website or her website, about mercury toxicity. Something about protocols that they follow. So our patients, you'll love this. This is how smart our patients are. We had a lady whose mother was going to come in Tuesday for removal of a mercury filling. She called on the weekend before. She said, my mom's filling came out. I said, what'd you do? She said, well, I put gloves on, and I took the filling, and I put it in a baggie, and I sealed the baggie. Then I put the baggie in a glass jar, filled it with water, and sealed it. She said, how'd I do? Teasingly, I said, oh, pretty good. She said, pretty good? What do you mean? What could I have done? I said, well, you could have put it in the only safe place. You could have put it back in her mouth. She got it. She laughed. It was fun. But that's not untypical of how educated my patients are.
Mm-hmm.
They know. And consumers are getting better, and the internet has opened the world up appropriately. So that's one thing. You got to get smart, and then you can get on my website for a list of questions to ask. Biologicaldentist.com is my website, and on the home page, on the right-hand side, is questions to ask of your mercury-free, mercury-safe dentist.
Mm-hmm.
There's a list of issues there that somebody would follow, and it's best to ask those questions as open-ended questions rather than saying, does your dentist use mercury fillings? What kind of filling materials does your dentist use? Rather than saying, does he use a dental dam and protect the patient's nose? And you need to ask the question open-ended. tell me what kind of protection your dentist uses for the patient. Those kinds. So you got to know some of the answers. You have to be prepared also for them to ask you after a few questions. So what are you looking for? The patient is looking for a dentist who will follow, who knows the protocols and is committed to following them strictly. So what are the protocols? I can break dentistry into 3 categories. One would be a general dentist. General dentist places and removes mercury fillings the same way he was taught in dental school. Same way that he learned it there, or she learned it there. Because half the dentists now are women who go to dental school, at least half. In my class, we had one woman who was a PhD in anatomy, and there was 130 guys. Now it's 50-50. Women and men, sometimes more women than men. I think that's terrific. And I forgot what I was going with
Yeah.
that.
So when someone's looking to have their mercury fillings removed, can any dentist remove fillings, and what exactly should you be looking for? I know you said ask these questions, but can you just go to like a regular dentist that's not a biological dentist to have your mercury fillings removed?
All dentists can remove fillings and do, but everybody doesn't do it the same. So a general dentist with no training, no education beyond dental school will do exactly what he did in dental school or she did in dental school. And that is scary. They've got a room of 15 dental chairs and 15 dental students, and they're taking out mercury fillings with no support at all for the patient, for toxicity. The dentists are themselves getting sick or exposed to it, and the planet is getting they don't have traps on I'm going to talk about each of those things if I may.
Yes.
Beyond the general dentist who's going to do it like he did or she did in dental school, there's a mercury-free dentist. So in 1984, when my receptionist said, "You didn't place a mercury filling this month," I said, "Great, I quit." I became mercury-free that day. That's good. It's a good start. It has nothing to do with mercury-safe. I didn't know any protocols. Patients would come and say, "You know the protocols." I go, "Not really, but I'll find them. I'll learn them." So it takes learning the protocol. So if we can take somebody who said, "I'm mercury-free," the second category of dentists after general, "I'm mercury-free. I don't place those fillings anymore." Great. That doctor needs to be encouraged, but don't go to him because he's not taking any safety precautions for the people, the planet, or the personnel. His own staff, himself. I'm not sure why dentists exceed all professions in suicide and divorce, but that seems to be the case.
Yeah, probably because they're so toxic.
And as a group, even the ADA has done studies that suggest that dentists and dental personnel have higher mercury levels in their body than other groups, but it doesn't concern them enough to do anything about it.
Yeah,
Yeah,
it's not surprising at all.
yeah.
And then there's a lot of dentists that say they won't do mercury, but they're put in gold fillings. And can you talk about some of the problems with that?
Well, there's a. I like gold restorations compared to any other metal that's out there. More people handle gold better than nickel. Gold got super expensive right after I got out of dental school. Not related to my getting out, but only at that time, only you couldn't have gold. You couldn't have bulk gold. Citizens couldn't, and gold cost $35 an ounce. It's only skyrocketing, and through the years went up to $1,000 and $300. So they started using alternatives to gold, and those were nickel-based alloys, titanium, things that didn't compare to the compatibility of gold. People didn't want to show gold. It could be covered with ceramic. I don't use any metals anymore. I haven't for years. It's when you mix metals in any environment, then you have an electrolyte like saliva, and the interactivity, the galvanic reaction, can cause some people horrible toothaches with the similar metals. So going back a little bit to the mercury-safe dentist, he's a dentist who's going to be mercury-free. Doesn't place it, but when he takes it out of people's mouths, he follows a strict protocol to protect the patient. The beginning level would be someone who is mercury-free, someone who protects the patient, ideally with a nose piece that covers their nose and not just a cannula that sticks up with two little straws. But that protects the patient's breathing. Wraparound glasses covers their eyes. Dental dam, best if it's not a rubber dam, but non-latex. Saliva ejector underneath that to pick up the vapors that might get through. 2 high volume suctions on the outside, or a single suction called snuffleupagus, a big suction that can be used. The patient is draped to their knees. We now cover their face with a towel, make sure they're comfortable with that being on them. I haven't had anybody who's not been comfortable enough to have that on during the 10 or 15 minutes it took to get the mercury fillings out. The patient, it's ideal when they're on a detox plan with trace minerals, and mercury is sneaky. Well, I'm not mix myself up. So you're on a detox plan, so working with somebody like you who knows how to get it out, knows what the patient's symptoms are, that's critical. And that's just the protection of the patient. We started wearing about 20 years ago a mask. Covers my nose, covers my mouth, has filters here that get replaced when it's time to replace them. Straps over my head, my loops with the spotlight, which I've never had a patient say, "Oh well, what's all that stuff you're wearing? Or why are you doing that?" Every assistant has their own in my office, and in tons of offices that are mercury safe. You got to protect the personnel. They have wraparound glasses. I have wraparound glasses. It's a critical element. And then you got to protect the planet. A dentist who's mercury free doesn't put new stuff in, but he is exposing his staff and his patient and himself to the vapors when it's being done. The suction system that picks up the particulate matter of the fillings is dumping straight into the public water supply system. Dentists have not been very good about volunteering to have that kind of system that picks that up. I heard about that system 30 years ago, and I've had one for 30 years. Changed offices, get a new system. I have a system that picks up all the mercury stuff that comes out of 5 treatment rooms and collects it. And once a year, sometimes twice a year, you have the trap that goes in there. It's collected the mercury for that period of time. We're responsible. The dentist is responsible for that mercury affluence We registered mail, not U.S. mail, but another carrier, send that to a company that is called Cradle to Grave. We mix it. We're responsible for it until we have a notice from a legally trained company that they're going to dispose of it properly. Any dentist who's not placing it and taking it out and doesn't have a trap is creating that kind of problem for her. So that's a start.
Mm-hmm.
The building that we moved into, I was so excited because, oh, look, they already have air conditioning here. Well, the insulation was on the inside of the ducts. I was advised that's not a good idea. So I got to do my whole new system for myself. Take out theirs, put the insulation on the outside so the air is running through only the duct stuff and not all the stuff that the insulation would have. The corners, I don't have corners in my treatment rooms. It's rounded because mercury would get caught in the corners.
Mm.
Every chair, this is common in the best dental systems. Every unit, you have your own water supply, not the public water supply. We put ozonated water in there, and that's what when we spray water from the handpiece or whatever, it's not the public water. those are things that another thing in that regard about a mercury-safe dentist. We know we're taking out something that for most people is just totally toxic to them. But if a patient has sensitivities, a history of allergies, and for us, any patient, before we put a new restoration in their mouth, we're going to check the compatibility of it.
Yeah, I was going to ask you about that. Like, how do you check for compatibility? This really interesting concept of how you choose the right dental materials to put into a filling that works for the patient. That's amazing.
Well, and some people, they're great with everything. The test that I like the best that we use is called meridian stress assessment, electronic acupuncture, or EAV, electronic acupuncture by Voll, a German physician dentist who figured out this system. But we have 12 different local anesthetics. The next section is bonding agents, and there's 8 of those. Composite kinds of fillings, and I have my favorites that are technically excellent, but sometimes I don't use what I like the best because they're more compatible with another one. All that I have listed are compatible, good materials. So if I have another dozen materials for composites, for metal, for everything, for a night guard, for an implant, although I don't do implants, it's a way for us to see what we're going to put in that they're going to best react to, or least react to, would be the same. Some dentists like to do muscle testing, and they're very expert at that, and I'm comfortable with that. I just don't like that technique for determining compatibility. Um, there's 2 companies, Blanche Ruby and Jess Clifford. Each have a company that you draw blood, you send it to them, they do a serum test and check it against 500 elements to see what would cloud the serum. If it clouds the serum, then you don't use that material if it's in a dental product. I don't like that one so much, but many do. Everybody doesn't have somebody that can do the meridian stress assessment. But that is a way that a sensitive person can have more assurance that what they're going to have put in is going to be compatible for them. No promises, but certainly there's a lot of detail and attention to that element.
Do they put, do some dentists put mercury or other metals in root canals?
It is very common for dentists to put mercury filling inside as a filling material, as a base for the root canal tooth, which is weaker. Uh, so, and some, I'll get them. Yeah, it's not a good thing. It's not a good idea from my perspective to put mercury in anybody's mouth for any reason. They used to say, well, you can cover it with the gold crown because there's no mercury vapor. So they showed them studies of mercury fillings in teeth, in the bone around the teeth, in cadavers, extracted the mercury filling and analyzed what the mercury level was in the bone around teeth that had mercury fillings. And there's a measurable amount. If there was a gold crown on top of the tooth, then there was like 50 times more mercury driving it into the bone. And the ADA said, well, 50 times nothing is nothing. So that test doesn't mean anything. Once again, not going to get help from them.
No.
In dental schools they teach, my patients are shocked that they're still teaching to place mercury fillings in our city, in our state. 3 schools, they all do the same.
Yeah. Well,
So
who's actively leading dentistry in the U.S. in the correct direction of, eliminating mercury fillings?
the 2 groups that I mentioned, the IABDM and the IOMT, are 2 groups that are very active in teaching dentists, in qualifying dentists. They have them take oral and written tests to get to different levels to say, okay, I'm a certified dentist in this organization, which means you can join if you send them the dues, but you can qualify yourself by saying, I need to know how to do the protocols. Whether they do it is a personal thing, and I'm sure that some people uh, would lie about it, but certainly um, you can look at the website and see those things and get a feel for how that office is and how you. Now, beyond that, there's a gentleman named Charlie Brown, I mentioned earlier, who is the head of Consumers for Dental Choice, and he spends every minute of every day working on this issue. There was a Minamata Bay conference in Japan, and they were going to go out to the people to all the countries in the world to get their support to discontinue the use of mercury fillings. Well, the United States was the first country to sign it, but the FDA didn't sign it. It wasn't they weren't part of the signing, so it was a little bit of a sham. Charlie Brown has just started I'm going to read this, challenge the FDA's no right to know policy. You have a right to know that every mercury filling is 50% mercury. Excuse me. He has a petition here to notify people about the same things that I talked about to the FDA. Label stuff properly. Let people know. Let them decide. I would encourage you to get on consumersfordentalchoice.com and participate in this petition, because we can't. The government's not going to do it for us. We have to educate ourselves until so many people know that it's just, it's like asbestos. Asbestos causes mesothelioma. Everybody knows it. somebody gets diagnosed with mesothelioma and lung disease, they're going to die, and they were exposed to mercury at some time in their life. So the alternatives just line up. When were you exposed to asbestos? We're going to help you out. We're going to get you some money. And it works every time. Mercury is so sneaky, it doesn't cause that, as we've talked. It picks on people's genetic weak link. So we can't count on the mesothelioma kind of story, but like you have with asbestos, but we can count on one another and educating one another, making it just such a public awareness event that that there's, and we have alternatives. We didn't have alternatives the first 10 years I was placing them. We got some alternatives. I presented it in a different way. I used to say, now, I'm more interested in how long you last than the filling lasts. So that's why I'm recommending this one.
Yes.
And I didn't lose very many patients who said, I want the one that, people don't argue. Well, nobody in our practice argues to have it because they all decided. I could, if I've been talking about mercury-free, mercury-safe, a term that I was asked to write an article about what's biological dentistry. Um, if I could, I'd like to read the article that I wrote because it talks about and kind of summarizes the issues that we're talking about with mercury. And our listeners and watchers are going to realize that they've learned a whole lot of things about making decisions about it. What's a biological dentist? A biological dentist is a licensed dentist who uses the greatest elements and practices of conventional dentistry, who also has a great appreciation and gives consideration to the relationship of teeth and oral health to the body. Holistic. Some of the elements and practices of conventional dentistry used include many of the wonderful and effective dental materials. So we pick from the same pile that every dentist picks from. We just sometimes pick with a little help. The difference would be in a biological dental practice, the dental materials are tested. I know about that. Minimal use of metals, you know about that. 50% of the dentists don't place mercury fillings, you already know that. We call that mercury-free and a good start. What's mercury-safe? We protect the planet, the patients, and the personnel. A practice concerned about mercury from mercury fillings. There's mercury trapping systems in the office to keep the mercury from being dumped into the public water supply. During removal of the fillings, wear caps. Healthy air protection. Modified removal techniques. Some of this is for dentists. About the dental team protection. That's some of the things that people hear the term biological.
Mm-hmm.
And once again, nobody gets to lock the definition. This is what it means. That's what it means to me.
Yes. Well, thank you so much for coming on the show and sharing your long-term expertise on the dangers of mercury fillings and how to remove them properly. Because a lot of my clients come to me and have mercury fillings, and should I remove them? They ask me, I'm like, yes, you should remove them. They're probably contributing to health issues and symptoms that you have, and unfortunately, people end up going to conventional medical doctors and are given medications and really never addressing the underlying true cause of their fatigue and brain fog and serious health issues. And you really do need to look into removing your mercury fillings, in my opinion.
with a mercury-safe dentist.
Yes, yes, exactly.
And you got to educate, but going, it might be better, but for some people, it's not better to have them out if it's not done in the way that we've discussed. And I think they'll be asking good questions.
Do you advise people, like if they have cancer or another serious illness like that, if they should remove the mercury fillings or wait until they're in remission or better?
My patients are different than a lot. A lot of them come. Wait, as a biological dentist, I don't use mercury fillings and haven't. I don't much like root canals or dead teeth. So patients come to me, they're pretty set on what they want to do. They want the mercury fillings out. I promise them nothing and I give them everything that we have about protection. Depending on, I have people that will come and say, they're going to start, excuse me, they're going to have surgery and they're going to schedule in 3 months, 2 months, whatever. I want to get everything taken care of. So we're going to look at what's on that. They got breast cancer. Teeth are associated with the body just like every bone in the body is connected, following the principles of acupuncture. So, excuse me, stomach and breast are on the molar meridian, first and second molars. If they've got a root canal tooth and a breast cancer, same side, I cannot promise anything. And if they want me to take that tooth out, I'm glad to take it out. So, it depends where people are in their process. Um, but they need to be working with a dentist who's comfortable and understands that. Uh, and I'm somebody who tells them a bunch of stories on this is going to fix this and fix that. Um, but I just like to start with not putting it in.
Yeah, yeah.
Take it out safely. And which your question is very good.
Yeah,
And
I
it's,
mean, I think it's important. I mean, again, everyone is different. It's just kind of every situation is different,
yes,
and you need to work with a qualified biological dentist to determine your situation. And I have a question I like to ask all of my guests. What do you think is the most pressing health issue in the world today?
in the world, I don't know about the world. I know that in the United States that we have is in the our statistics about how we take care of our newborn babies. We rank about 17th in the world in the safety and survival of newborn infants. Whatever that's involved, if that's about vaccines and we vaccinate faster and more than anybody in the world, I don't know. We have the most expensive system in the world, but it's not protecting newborn babies. If you can't, if you can't start there, then then I'm sorry if you don't have a job that requires that. But,
Yeah, when I first read that statistic, I was shocked. First read it in Consumers Reports, and it's saddening because you think the United States, we have some of the best doctors and best
yeah,
healthcare in the world, and
it's
we
expensive.
don't. We do not.
No, and when I say most expensive, I'm not ragging doctors, insurance companies, hospitals. There's a lot of people making a lot of money in this process. It's pharmaceutical companies. It's maddening.
Yeah, it's all about money. Absolutely. And patents, Harvard Medical School and other schools own patents, make a lot of money, and they don't want anyone shaking up the status quo and bringing in new testing equipment and natural health, natural cures and whatnot, just not in their plan. So, Dr. Glaros, why don't you tell the listeners where they can find you, get more information about biological dentistry and how to remove mercury fillings correctly?
I'm in contact both those two sides, IOMT and IABDM, and people can get on our website, biologicaldentist.com. And I got that website, let you know I've been doing this for a long time.
Yeah, I know. I thought, wow, you're gonna be one of the first people that got that,
Uh,
had to get that.
uh, so, and and call the office and interview them. And your listeners, your watchers, are the kind of people that are educating themselves and not waiting for somebody to come down and fix them. So that it's I would think that it would be becoming a student and learning this, learning what to ask would be a natural outcome of your kind of people.
Yes. Well, thank you so much, Dr. Glaros. That was very, very educational and very, very important information. Thank you so much for coming on the show.
My pleasure. Thanks.
And listeners, if you want to learn more about me, you can go to live to 110.com and learn about my healing and detox program, mineralpower.com, where I can help you to detox mercury properly and safely. Thank you so much for listening to the Live to 110 podcast. And thank you so much for coming on the show.
Thanks for having me on, Wendy.
Well, why don't you tell the listeners a little bit about yourself and your background?
Yeah, I'm a board-certified plastic surgeon. I've been in private practice in the Metro Detroit area for about 12 years, and I practice primarily cosmetic medicine, but I also do some reconstructive surgery as well. And I'm the author of a new book called The Age Fix. A leading plastic surgeon reveals how to really look 10 years younger.
So tell us a little bit about the Age Fix.
So the Age Fix basically is kind of a culmination of being in private practice for 12 years. I do a lot of surgery, but as a surgeon, I understand that surgery is dangerous. You know, people have complications. People can actually die from surgery. And after doing this for 12 years in private practice, 17 years overall, I've really determined that I believe everybody can look 10 years younger without going under the knife. And there's so many things that we can do short of surgery that can turn back the years, that can make our skin look nicer and give us the appearance that maybe we want without having surgery. And that's what the idea behind writing the Age Fix is, how anybody can read this book. They can follow the guidelines and the recommendations that I give and look 10 years younger. And it does not entail actually going to see a doctor and going under the knife.
Yes, yes. So in the book, you talk about, how to eat a healthy diet. So how does what you eat affect, what you look like? How does it determine the age that you appear?
Yeah, I think what you eat really does determine to a large extent how quickly you age and how your skin looks. And so in the book, I kind of outline the Age Fix diet, which are foods to eat, foods to avoid, to slow down that aging process. And as you know, I'm sure a lot of your viewers, your listeners have heard, sugar is not only horrible for our health, it's horrible for weight gain, but it's also horrible for our skin. So those same things that make sugar bad for our health and contribute to heart disease and other types of medical issues can also contribute to aging of our skin by creating inflammation and by the process of glycation.
Yes. Can you explain that a little bit? Because I know the process of glycation, it will wear out your collagen, so your skin just isn't
Yeah.
as elastic, where your skin just doesn't hold up as well when you're eating a lot of sugar.
Yeah, so it's kind of two main things. So sugar itself, when you that are rich in sugar, and when people think about sugar, they think about sugary snacks, sugary drinks, desserts. But a lot of the sugar that we get in our diet, in that Western diet, is from refined carbohydrates. So people don't even think about it as sugar, like white rice, white bread, pasta. You can get sugar spikes in your bloodstream from the sugar, and this leads to